Dr. Mahendra Biradar brings a wealth of experience in treating lung diseases, allergy and immunotherapy, and sleep disordered breathing. Social media, YouTube, and a good nap. Which one would you prefer?
Social media and YouTube are always very tempting. He takes out his inhaler and puffs it here.
Oh, like perfume. So, what precautions should we take? Like, if I'm living in an area which has high pollution, what precautions can I take?
It is very difficult to avoid pollution, but
Is lung damage from vaping and smoking reversible?
to some extent, like it depends on how.
There's a common misconception between asthma and chronic cough. Can you clarify that for us?
Cough is a presenting symptom in many diseases. So even in asthma, it can be a presenting symptom, but you should know.
When should an allergic reaction be considered a medical emergency?
In severe cases, మనం చూసేది ఏంటంటే
So, we've recently heard about this case where a person was suffering with breathlessness, and when the basic tests were done, they saw that there's no issues with the lungs. So, how do you handle a situation like this? Welcome, doctor. Thank you for joining us.
Thank you. It's my pleasure to join you.
So, doctor, I wanted to start with a very important pressing question. How are you related to Mahendra Bahubali?
It's just a coincidence, just the same name, nothing else.
All great men have shared names, I guess.
Thank you for the compliment.
So, can you tell us a little bit about your journey?
So I have done my schooling from Karnataka, Bidar district. Then I was in Bangalore for my higher studies. Later on, I pursued my MBBS from a government college that is in Bidar itself. Then I have also been to Maharashtra for my post-graduation studies, that is MD in respiratory medicine. Later on, I then shifted to Telangana, Hyderabad, because it is a very close nearby place to my hometown. So I have been practicing here since. And I have also done my fellowship in interventional pulmonology and also certified courses in allergy and sleep therapy.
That's a lot of different diseases that you'll be teaching us about today.
Yes, hopefully.
So, now for serious questions. What is an allergy?
So an allergy is basically a hypersensitive reaction of the body to an allergen. So we see a lot of allergens in the environment around us. So the same hypersensitivity turns out to be allergy, and symptoms are produced in the body.
And how is this different from a common cold?
Common cold or flu or viral infections are due to certain viruses, or it can be due to a bacterial infection. In that sense also, flu and viral infections are different. Viral infection can be anywhere in the body. When it comes to particularly about flu, it is related to respiratory system. So infection of the lungs or the respiratory tract is known as flu.
So, the reaction that the body gives is similar, the source is different, is it?
Infections are different and allergies are different. Allergy is a reaction to the allergen from the body, but infection is due to some infection causing organism like a virus or a bacteria. So that way they do differ. Symptoms may overlap, they may be similar, but the etiology, the cause of the symptoms are different.
So, what are the various symptoms of allergy, and how does a person know that they have allergy?
Yes, coming to allergies, allergy can present in various forms. సో మన దగ్గర వస్తున్న పేషెంట్లో మనం చూస్తాము, దే ప్రజెంట్ విత్ కాఫ్ సమ్టైమ్స్ షార్ట్నెస్ ఆఫ్ బ్రెత్, ఆయాసం ఉంటుంది, తర్వాత తుమ్ములు, స్నీజింగ్ దిల్ ప్రజెంట్ విత్, అండ్ సమ్టైమ్స్ వీజింగ్ ఈజ్ దేర్, పెళ్లి కూతులు అంటాం. సో దట్ ఈస్ ద వన్ ఆఫ్ ద ప్రెజెంటింగ్ సిమ్టమ్స్. ఫ్యూ పీపుల్ మే ప్రజెంట్ విత్ అ ర్యాష్ అండ్ ఇచ్చింగ్, దురద రావడము, స్కిన్ ర్యాషెస్. Then few people present with redness of eyes, watering of eyes, also headaches, vomiting. So these are all symptoms that we see in allergy. But if we classify into presenting forms, it can be one of bronchial asthma antam, that is ayasam ravadamu, దగ్గు రావడం, పిల్లికూతులు రావడం, or else allergic rhinitis, తుమ్ములు రావడము, ముక్కు కారడం, running nose. Then it can be allergic dermatitis, rashes and rashes over the skin, and allergic eye disease, again redness of the eyes. And finally, we can call it sinusitis, where the sinus space are filled with mucus. Patients are known to have headaches, ear pain and all. These are the various presentations of allergy.
So, there's a wide range of.
Yes. The underlying cause will be allergy basically, but the presentation is in varied form.
So the same allergen can cause different reactions in different people?
Yes, definitely. Allergen is just an allergy causing antigen which can produce various symptoms in an individual. So presentation నేను చెప్పినట్టు ఎలాగైనా ఉండొచ్చు, రైట్ ఫ్రమ్ బ్రాంకియల్ asthma to allergic rhinitis, allergic dermatitis ఏదైనా ఉండొచ్చు.
What are the common allergens that we are exposed to, whether it's indoor or outdoor?
Yeah, the allergens that we are exposed to generally, most commonly that people come to know is dust. So whenever a patient comes to me, the most common history given by them is నేను డస్ట్కి ఎక్స్పోజ్ అయినప్పుడు నాకు సిమ్టమ్స్ వస్తాయని. సో డస్ట్ ఈస్ ద మోస్ట్ కామన్ allergen that we see. As a matter of fact, not exactly dust, there are some microscopic organisms called dust mites, దుమ్ము పురుగులు అంటాం. So they are present in the dust, which in turn cause allergic symptoms. And apart from that, pollen, as you know, they are the droppings of trees and all. They are again seasonal also, and there can be other allergies due to fungal exposure or pet exposure. If you have a dog or cat at your home, then it can be anything related to food. తినే ఆహారం నుంచి కూడా మనకు అలర్జీ వచ్చే ఛాన్స్ ఉంటుంది. So it is a wide spectrum of allergens are there. To identify it is very difficult.
What are the typical ways that people get exposed to these allergens?
The route of exposure can be anything, right from inhalation to injection, or else just contact through skin. So when it comes to inhalation, generally what we see is the allergens are dust, pollen. These are the most common allergens we are exposed to. When it comes to ingestion, food allergies are the most common, or even for that matter drug allergies. Then injection, something like a insect bite, a bee sting can be through injection. Also drug allergies again, and through contact, I mean skin contact, there are many allergens that are known to cause these type of allergies.
What are the triggers for these allergies, like environmental factors or pollution, lifestyle changes? There's so many things that we keep hearing about.
So triggers are basically those things which when a person is exposed to, they'll trigger your existing allergies. Triggers do not cause allergies directly. Allergens are the ones causing allergies, but triggers ante em vastundi, like we see cold exposure. People generally give history, నేను ఏసీలో కూర్చున్నప్పుడు నాకు ఈ సిమ్టమ్స్ వస్తాయి, దగ్గు వస్తుంది, ఆయాసం వస్తుంది అనేది. దెన్ ఆఫ్టర్ దట్ something like stress itself is a trigger. Whenever a patient having allergies takes stress, like an asthmatic patient, if that person goes into stress, then shortness of breath starts. And again, in the similar way, exertion, any heavy exercise can be a triggering factor. Smoke is one of the major triggering factor. పొగ ఉంటే కూడా చాలామందికి ఆయాసము, ఈ అలర్జిక్ సిమ్టమ్స్ అనేది వచ్చేస్తాయి. దెన్ ఇన్ఫెక్షన్ ఈజ్ వన్ మోర్ ట్రిగర్, because infection in turn will lead to allergic symptoms, especially in asthmatics or allergic rhinitis patients. We see when they have infection, they have associated allergy symptoms. So that is one of the causes, and one of the most neglected causes is acidity, GERD antam. So that also acts as a trigger for allergic symptoms.
So you're saying triggers and allergens are different?
Allergens are the substances to which the person is sensitive to. Triggers are the substance which triggers the allergy symptoms whenever exposed.
Got it.
They on their own can't cause allergies. Person who is having allergies, when exposed to those triggering factors, he or she will start having symptoms.
So the trigger can be considered like a catalyst.
Yes, as a catalyst or as a stimulant also sometimes. Yes.
So it's the allergens that we should be more worried about, basically.
Both, in the sense, because both are causing trouble to the person, so we have to be worried about both the things.
So you're saying we need to consider the triggers as well, and pollution is a trigger and it's everywhere around us. So what precautions should we take? Like if I'm living in an area which has high pollution, what precautions can I take?
Very difficult to avoid exactly when you are traveling when you are in a metro city, crowded place, and you are traveling every day. It is very difficult to avoid pollution, but simple measures like wearing a mask. When you're stepping out, try to move around in a car, a closed space where you are least exposed to pollution. And also whenever the traffic is less, you can preferably go out at that time. These are the few measures through which you can reduce exposure to pollution, but you can't completely avoid it.
If a person has a runny nose or sneezing, how do they know if it's allergy or if it's infection?
See, generally, runny nose, sneezing can be there in viral infections also. Like a common cold can cause runny nose and sneezing. But persons who have allergy, they have these symptoms recurrently. So when there is recurrence of symptoms, then we have to think of otherwise. Like it can be something more than an infection. And generally, what we see is infection is associated with fever. సో జ్వరం అనేది వస్తుంది ఇన్ఫెక్షన్లో కానీ అలర్జీస్లో జ్వరం ఉండదు సో అగైన్ దెర్ క్యాన్ బి అన్ ఓవర్లాప్ ఇన్ఫెక్షన్ వచ్చినప్పుడు వీ క్యాన్ హ్యావ్ అలర్జిక్ సిమ్టమ్స్ బట్ ఫీవర్ ఈజ్ వన్ ఆఫ్ ద symptom that we see in infection only and not in allergies.
So every time you have infection, you have fever?
Not necessarily. Sometimes it is a mild infection, you don't have fever, only symptoms. For example, let's take an example of a cough. Okay, so it can be allergic cough or an infective cough. So suppose you have a throat infection. At that time, the most common thing we see is sputum production. That generally, if it is a bacterial infection, what we see is it is
Sputum is a mucus?
Yes.
Okay.
So that is a colored sputum generally. Temada antam kada, that one. So that is colored. Generally it is green, yellow, something like that in bacterial infections. But when it comes to allergic cough, we see it is sticky, white colored sticky sputum untundi. So that is how we can differentiate a little bit. But to better get a clarity about it, I think visiting a doctor is always good.
When should an allergic reaction be considered a medical emergency?
So there is something called anaphylactic reaction or anaphylaxis antam. So this is a severe hypersensitivity reaction to an allergen. Most commonly we see this in food allergies. ఏదో తిన్న తర్వాత ఇమ్మీడియట్గా ఆయాసం రావడము, వామిటింగ్ అవ్వడము అండ్ గిడ్డినెస్ తల సుత్తడము ఇవన్నీ వస్తాయి. సో ఇన్ సివియర్ కేసెస్ మనం చూసేది ఏంటంటే పాల్పిటేషన్స్, గుండె దడ పెరగడం అండ్ ఆల్సో బీపీ పడిపోవడం, హైపోటెన్షన్. సో దీస్ ఆల్ సిమ్టమ్స్ ఆర్ దేర్ అండ్ ఈవెన్ దేర్ మే బి అ ఫాల్ ఇన్ సాచురేషన్, ఆక్సిజన్ లెవెల్స్ డ్రాప్ అవ్వచ్చు. సో దట్ ఈస్ definitely a medical emergency. In such case, you will have to visit a hospital immediately. And sometimes we see swelling of the tongue, choking may be there. Adi unnappudu kuda it is a medical emergency. So if you visit a hospital immediately, your doctor may give you some injections or an adrenaline shot. So that will help you recover from those severe symptoms immediately. And later on, whatever treatment is required is will be followed.
How are allergies and asthma related?
So you can say asthma is caused due to allergy. So whenever a person is allergic to an allergen, when that person gets exposed, goes through symptoms as I mentioned previously, he can present with symptoms. So one of the symptomatic presentation is asthma. So that cough, whether it be dry or with mucus production and shortness of breath, wheezing. So that is a presentation of asthma. So it is not necessarily that a person who has allergy should present with asthma only. He can present with any of the forms of allergy.
But anyone with asthma definitely has an allergy.
Yes.
So can untreated allergies lead to asthma then?
Suppose if a person has presenting symptoms as rhinitis, I mean sneezing, running nose, have like the person can have more symptoms in future. The person can become an asthmatic also. So a person having allergic rhinitis can then have asthma, can then have allergic eye disease, again allergic dermatitis. So all of these presentation may start. So initially, generally what we see is allergic patients, they start showing few symptoms related to one particular thing. Then if their allergy is unchecked or untreated, then it increases and other symptoms start appearing. So it is better to get it tested and treated as soon as possible.
There's a common misconception between asthma and chronic cough. Can you clarify that for us?
See, cough is a presenting symptom in many diseases. So even in asthma, it can be a presenting symptom. But you should know like when a cough is not asthma. If you have a persisting cough more than 7 days, more than a week, because cough can be there in something as minor as a throat infection, something like allergies. Many people have asthma where there is a cough variant asthma. I mean, those people won't be having breathlessness as a symptom. Ayasam anedi undadu, only దగ్గు అనేది ఉంటుంది. So predominantly dry cough, podi దగ్గు ఉంటుంది. So in such cases, it is a allergic airway disease or you can say chronic bronchitis or cough variant asthma. That has to be differentiated from an infection. Again, at the same time, 15 days కన్నా ఎక్కువ దగ్గు ఉంది అనుకోండి, you may be having a lung infection or you can even have TB, pulmonary tuberculosis. So we always diagnose a disease with associated symptoms. దగ్గుతో పాటు ఇంకా ఏమేం symptoms వస్తున్నాయి. Like in tuberculosis, what we see is there is a loss of appetite and loss of weight loss kuda untundi. So when associated symptoms are there, we evaluate the patient further and we try to find out the cause for that particular cough. So just assuming that every cough is not that severe or every cough may be something critical is not correct. Better to get diagnosed with the reason, like what is the etiology, what is the cause of that cough, and get it treated.
Many people today are having lingering cough and breathlessness and other issues after viral fever. What could be the underlying cause for that?
See, many people these days are presenting, as you said, their symptoms are similar to asthma or any allergic disease. The viral infection, there is something called reactive airway disease. So there the patient will not have any allergies, but due to a viral infection, the airways have become hyper-responsive or reactive. So at that time also, person may present symptoms which are very similar and confusing with allergies and asthma.
So the viral infection has come and gone, but the cough has not gone away.
We have seen very commonly during COVID infections, like whenever the patient had COVID infection, even after recovery, they have come a lot of times. You might have heard like నాకు కోవిడ్ వచ్చి పోయిన తర్వాత కూడా ఆఫ్టర్ రికవరీ కూడా నాకు ఆయాసం వస్తుంది, దగ్గు వస్తుంది. సో వాట్ ఈస్ ద రీజన్? డూ హ్యావ్ ఎనీ ఫర్దర్ ఇన్ఫెక్షన్ ఆర్ డూ హ్యావ్ ఎనీ అలర్జీస్? బేసికలీ ఇట్ ఈస్ రియాక్టివ్ ఎయిర్వే డిసీజ్ that has developed due to viral infection.
So this is not related to allergy nor the virus.
No,
It is a new.
it is a sequelae of viral infection basically. ఒక్కసారి ఇన్ఫెక్షన్ వచ్చిపోయిన తర్వాత these are continuous symptoms or not. So they also need to be treated appropriately. Otherwise, it may trouble the person.
Can acidity cause similar respiratory symptoms?
Yes, definitely. Acidity is one of the known triggers. Generally, we call it as GERD, gastroesophageal reflux disease. So, especially in asthmatics, acidity is known to trigger the symptoms. Ask our patients to avoid food which are citrus in nature. Pulpuga unna food తీసుకోవద్దు, spicy food తీసుకోవద్దు, ఎక్కువ fried oily food తీసుకోవద్దు, and even cold food like curd. And even when it comes to fruits, citrus fruits like orange, mosambi, grapes, those are to be avoided. Something which causes a cold, watermelon, guava, jampandu, and artipandu, banana, those things have to be avoided. These may act as a trigger for existing allergies and asthma.
But avoided throughout the year, or is there specific time?
When you have allergies, better to avoid it throughout. The answer to your question further will be provided, like what is the treatment and what is the solution for this. So once we go through that, if your allergies come down, maybe you can resume having all those things.
So it's not like winter season lo avoid these foods.
No.
It's generally if you are allergic.
Avoid these foods throughout this year.
Are autoimmune diseases and lung complications related?
Yes, we have lungs are known to be involved in autoimmune diseases. So many diseases like rheumatoid arthritis, then SLE, systemic lupus erythematosus, then comes your dermatomyositis, polymyositis. These are all autoimmune diseases. So where there is secondary lung involvement in the form of ILD, interstitial lung disease, that is what we call. Just to give a brief, interstitium is a layer between the lungs and the blood vessels. So where the oxygenation takes place. So the oxygen enters from the lungs into the blood through that particular layer. But what happens in interstitial lung disease, that layer gets hardened. ఆ ఇంటర్స్టిషియం అనే లేయర్ గట్టిగా అయిపోతుంది. సో అది అయినప్పుడు మనకు ఆక్సిజనేషన్ అనేది తగ్గిపోతుంది. వెనెవర్ in such situations, whenever a patient is walking or doing everyday work, shortness of breath, ayasam anedi vastundi, and there will be a fall in oxygen levels. So this is a secondary presentation or complication of autoimmune diseases that we generally see. So whenever a patient has these autoimmune diseases, they should be evaluated for a lung disease also.
It almost sounds like whenever you have shortness of breath, it's better to get your oxygen levels checked.
Yes, definitely. I think COVID has given a good lesson to everyone regarding the same. Whenever you have shortness of breath, don't consider it, don't take it lightly. Get it diagnosed, get it checked. So check your vitals, parameters, how they are. So that if it is something which is going to progress very rapidly, we can catch it early and treat it at the earliest.
So what is an acceptable level of oxygen?
See, a normal person's oxygen levels are always above 95.
Okay.
But in cases where there are chronic diseases like COPD, chronic obstructive pulmonary disease, these we see generally, especially in smokers who have smoked for a lot of years, even though they might have quit, but at a certain age, when they are old, the symptoms start. Symptom ante general ga manaku nadustunnappudu ayasam raavadam.
Right.
So that is the most common presenting symptom. So alanti patients lo manaku oxygen levels takku. And also in ILD patients, one classical symptom is breathlessness on exertion and desaturation. నడిచినప్పుడు ఆయాసం రావడం and oxygen levels పడిపోవడం. That is a classical symptom of ILD. We need to get checked for all these things.
And at what oxygen level should we rush to an ER?
See, anything less than 90, definitely you rush to an ER. 90 to 95, acceptable, but you need to monitor. Anything above 95 is normal.
Okay.
But less than 90, definitely rush to your ER.
Everyone has some level of allergy in their system. So how do we get tested and how do we know where we stand?
So basically recognizing your symptoms first is very important. మనకు ఇబ్బంది అవుతుంది అంటే first we have to recognize those symptoms and approach the right person. Allergy practicing doctors are different. So whoever practices allergy, if you approach them, that is better. Because
Such
they
as
can-
yourself.
Yeah, they can catch it early and they can ask you for further testing. Testing as such includes some blood tests where we see for most common type of allergy. And once if there is allergy proven on the blood tests, we generally go for something called a skin prick test. That is a gold standard in allergy testing basically, that we do on our skin. To just give you a brief idea, what we do is we do have a allergy kit. మన దగ్గర ఒక కిట్ ఉంటుంది. That kit has like various number of allergens. How many number of allergens are included? Because it is not possible to include each and every allergen present available. So we just make a set according to the place we are practicing, so that the person coming from there, అంటే ఇప్పుడు pollens ఉంటాయి, so that region specific pollens may be different. Food allergies, that particular region people may be having particular kind of food. So accordingly we create a kit of customized kit ఉంటుంది. So it is not universal. So we decide what allergens to be included in the test. The idea of allergy testing, I will give you, like just one drop of the allergen is placed on the skin and then a small intradermal prick is done just to introduce the allergen into the skin layer. It is not at all painful. మనం ఫస్ట్ టైం చెప్పినప్పుడు అందరూ ప్రిక్ చేస్తారు అంటే భయపడతారు, but it is nothing like that. It
So
is
not like
at
an
all a painful
injection,
process. No.
just like a...
It is done using a needle, but I can do it even on a child. Even the child won't feel it to be painful. It is just a small intradermal prick into the layers of the skin. We just introduce the allergen into the skin. So later on, దేనికైతే allergies ఉన్నాయో అక్కడ ఒక rash అనేది form అవుతుంది. Something like a wheal అంటాం. So that shows us that what all you are allergic to. So that is how we test for allergies.
So blood test and this allergy.
Blood test and skin prick testing is the way to go for allergy testing. There may be other tests also, like in blood only. Few people prefer to do allergy testing on blood itself. I mean, what type of allergies to what a person is allergic to అని బ్లడ్లోనే టెస్ట్ చేస్తారు, బట్ దట్ ఈస్ నాట్ ద గోల్డ్ స్టాండర్డ్ యాజ్ సచ్. స్కిన్ ప్రిక్ టెస్ట్ ఈస్ ద గోల్డ్ స్టాండర్డ్. సో ఐ వుడ్ ఆల్వేస్ సజెస్ట్ ఎవ్రీ వన్ టు గో ఫర్ స్కిన్ ప్రిక్ టెస్ట్ రాదర్ దెన్ blood testing. Blood testing we can do in those patients where skin prick testing is absolutely not possible. I mean, ఎవరికైతే సివియర్ స్కిన్ అలర్జీస్ ఉన్నాయో, that also if once controlled we can go for a skin prick test. But if we are not able to control those symptoms, then maybe we can think of allergy testing on blood.
So you'll get better results through the
Skin prick testing, yes. Yeah.
Do we need to repeat allergy tests? Like if you got it done as a child, should you get it done again after a few years or?
Not required as such. Generally when you have few allergies, either they will subside on their own, or you will be carrying the same allergies for your lifetime. So there is no need to repeat allergy testing as such. In cases of food allergies and all, maybe you are having something new. ఏదో కొత్తగా తిన్నప్పుడు నాకు ఈ సిమ్టమ్స్ వచ్చాయి అంటే అప్పుడు like we may think about repeating an allergy test and doing for that particular allergen. Otherwise not required as such.
That's true. We're always guessing. I think I'm allergic to this.
The most difficult allergies to find out are food allergies, because not always you are not directly allergic to the food item you eat. It may be some ingredient that is used to make the dish, so that you may be allergic to, but it is not possible to know what it is exactly.
And you always eat in combination. You eat so many things at a time. It's hard to tell.
So things get overlapped. అప్పుడు అలర్జీ దేనికి అనేది చెప్పడం చాలా కష్టం.
So instead of blindly just quitting on certain foods, it's better to get a test.
Yes, I do ask my patients to keep on observing after eating, like what you had eaten when you got the allergic symptoms.
Yeah, I've seen some really diligent patients who keep a journal. I ate this and I had this reaction, and and try to compare notes.
We do ask our patients to do that whenever they have allergic symptoms.
So now coming to the treatment of these allergies, are antihistamines and inhalers enough, or what else is needed?
See, one information I'd like to give through this discussion is that the treatment that people generally take, like tablets, inhalers, or nasal sprays, generally what we prescribe is for asthmatics, we give inhalers. For allergic rhinitis people, we prescribe nasal sprays. Then again, we can prescribe eye drops for allergic eye disease, some lotions or creams for allergic dermatitis and all, and also some oral antihistaminics like allergy medications. But these are not to treat allergy as such. These are just for the symptoms, to alleviate the symptoms, to treat the symptoms, to subside the symptoms. So these medications in not in any way are going to treat your allergies. So one good way to treat your allergies is first get tested what you're allergic to exactly, and then there is a very good treatment called as immunotherapy. Very safe and easy treatment basically. సో వెన్ ఇట్ కమ్స్ టు ఇమ్యునోథెరపీ, ఒక్కసారి మనం అలర్జీ టెస్టింగ్ చేసామనుకోండి, వీల్ కమ్ టు నో ఈ 3-4 ఐటమ్స్కి ఐఎమ్ అలర్జిక్, లైక్ డస్ట్, వన్ పర్టికులర్ టైప్ ఆఫ్ పోలెన్, దెన్ సమ్ ఫుడ్. సో ఆఫ్టర్ టెస్టింగ్ వాట్ ఎవర్ ఆర్ అవాయిడబుల్ అలర్జన్స్ లైక్ ఫుడ్ అలర్జన్స్, వీల్ జస్ట్ ఆస్క్ యూ టు అవాయిడ్ స్ట్రేట్ అవే, డోంట్ ఈట్ దీస్ థింగ్స్. But aero allergens are not avoidable, like dust and pollen can't be avoided. You just breathe them. So అలాంటి దానికి మనం ఇమ్యునోథెరపీ అనే ట్రీట్మెంట్ చెప్తాం. సో ఇట్ ఈస్ జస్ట్ అ సింపుల్ ట్రీట్మెంట్ ఇన్ ద ఫార్మ్ ఆఫ్ డ్రాప్స్. ఇమ్యునోథెరపీలో there is no medicine or drug as such. Suppose if you are allergic to a particular type of pollen, so we give a pollen concentrate, that particular pollen concentrate for you to use it sublingually. You just place the drops, put the drops below your tongue. That is a way of taking the treatment actually. So those drops you have to take early morning. So over a period of time, we'll slowly increase the concentration or strength of the liquid. So that way, what we are doing is we are basically exposing your body slowly to that allergen and desensitizing your body. So once your body is getting desensitized, the severity of symptoms goes down. ఆ సిమ్టమ్స్ ఎంత సివియర్ ఇంతకు ముందు వచ్చేదో ఇప్పుడు ముందు వచ్చే రోజుల్లో రాదు. సో ఇట్ స్లోలీ గోస్ డౌన్. అండ్ ఆల్సో మీ మందులు అవసరం, ఇన్హేలర్స్ అనుకోండి, నేజల్ స్ప్రే అనుకోండి, టాబ్లెట్స్ అనుకోండి, ద నీడ్ ఫర్ దీస్ మెడికేషన్స్ విల్ కమ్ డౌన్ స్లోలీ. ఇట్ ఈస్ అ వెరీ స్లో ప్రాసెస్. అలర్జీ, treating allergy takes patience.
How long? Like, what's the timeline?
See, for immunotherapy, we advise at least 2 years to be taken. But generally, we start seeing results. I mean, patient has that well-being. నాకు ఇప్పుడు అలర్జీస్ తగ్గుతున్నాయి అనేది ఫీలింగ్, it will start after 3 to 4 months. Once the treatment starts taking effect, so they'll start having that feeling of well-being. Their severity of symptoms goes down slowly, and medicines కూడా స్లోగా we can stop. We can taper the doses. I mean, dose తగ్గిస్తూ మనం one fine day we can stop the medications and see if the patient can tolerate without the medications.
So this liquid that you're talking about, it's just natural things like.
This is an allergen itself that has been extracted in a laboratory.
Okay.
Like it is a liquid form of an allergen. Pollen ankondi, it is an aero allergen, but that the lab people convert it into a liquid form, which we can give sublingually to expose the patient to that allergen.
So there's no medicine involved here?
No, it is controlled exposure to an allergen. We decide the dose at which the patient is exposed to that particular allergen, so that he gets used to it, but at the same time symptoms rakud. So that is how we treat allergies. This is one of the best treatments I would advise to each and every patient who has allergies. Other way to treat is biologics antam. So biologics are basically injections. Examples are omalizumab, benralizumab, dupilumab. These are injections that we can give. These targets the allergy receptors in the body and decrease the allergies. But then again, these are a little bit costly affair. You'll have to take an injection every month, and it may cost it costs considerably higher compared to immunotherapy. Those are exactly medicines or drugs, you can say.
Inhaler or nebulizer? What is your pick?
Each of them have their own role actually. నెబులైజర్స్ మనం ఎక్కడ వాడతాము అంటే వెన్ సిమ్టమ్స్ ఆర్ సివియర్, చాలా ఎక్కువ ఆయాసం ఉంది అంటే ఆ పేషెంట్ ఈజ్ నాట్ ఏబుల్ టు టేక్ ఇన్హేలర్ ఆర్ ఎనీ అదర్ ఫార్మ్ ఆఫ్ వెదర్ ఇట్ బి ఎండిఐ ఆర్ డిపిఐ అంటాం మనం. సో దే కాంట్ టేక్ దట్. అట్ దట్ టైమ్ వీ జస్ట్ గివ్ నెబులైజర్. Even if patient breathes, that is enough. But for long term maintenance therapy, we do prefer inhalers. because nebulizers can't be used for a very long period. Again, there may be few side effects like exposure to the ice and all may cause issues. So for long term therapy, any day inhaler is used, and for short term or in severe symptoms or in patients who are unable to take inhalers, like some patients who have neurological problems, bedridden patients. So in such patients, stroke patients and all, they may not be able to take inhalers. So in such patients, we do advise nebulizers.
So for children versus adults.
Children, if very young age, early age, always nebulizer is preferred, because inhaler needs like a technique needs to be followed to take an inhaler, which the children may not be able to understand. So we just put a nebulizer mask on for children and ask them to breathe. So that will be easier that way. And children generally don't require these inhaled medications for a longer period. Maybe during a severe infection or some short term nebulization therapy may be required, like a mucolytic and all. So nebulizer will suffice for children.
What about all these herbal remedies that people recommend, like in the diet or steam inhalation, things like that? Do they really help with respiratory illnesses?
These therapies can be used as add-on therapies. So they just help to elevate your symptoms. Like suppose, let's say you have an infection, throat infection. If you just keep on taking herbal remedies or steam inhalation, it won't be sorted. So you will keep on having symptoms. So the main treatment will be of antibiotics. Then added therapy will be steam therapy or herbal remedies or whatever it is. So they'll have value as an add-on therapy, and then they can't be the main treatment as such.
Do flu shots and vaccinations help with our respiratory health?
Yes, definitely. Flu shots and vaccinations like pneumococcal vaccines do help with respiratory health. So flu shots we advise every year. In fact, as a matter of fact, we are running a vaccine drive right now at our hospitals, Magnaid Hospitals. So anyone interested can walk in and take a flu shot. So how do flu shots help? They help with viral infections basically. Seasonal viral infections are there. So whenever you take a flu shot, there are less chances of you acquiring those viral disease infections. So that way they help. And pneumococcal vaccines are again lung infection related. So you are better protected against respiratory illnesses when you take these vaccines.
Are antibiotics being misused these days for treating infections?
We have been facing a lot of issues with antibiotic resistance these days. See, it can be right from anywhere to the bacteria again becoming resistant to antibiotics on their own, but most of it is due to the misuse of antibiotics. Like taking an antibiotic over the counter. See, there are antibiotics do have a purpose. We do prescribe different antibiotics for different infections. It is not that one antibiotic is made for all infections. So we know about that. But when a person goes and takes over the counter antibiotic, what happens is he is bound to take a wrong antibiotic in the wrong dose for the wrong duration. So this what happens is indirectly leads to antibiotic resistance. Maybe if a person takes inadequate dose today of an antibiotic, so that infection, that particular bacteria in him may become resistant to that antibiotic. So in future that antibiotic may not work. And even the bacteria are gaining resistance against all antibiotics these days. So it is like we have to be very careful regarding antibiotic usage. Always a judicious use of antibiotics is advised, and I would say always visit your doctor, take your doctor's advice before starting any antibiotic. It is not to be done on your own.
Is lung damage from vaping and smoking reversible?
To some extent, like it depends on how many years you have smoked. There is a term called never smoker. A person who has smoked less than 100 cigarettes in his lifetime, he is considered as good as a person who has never smoked. But then again, for what duration you have smoked cigarettes, ఎన్ని సంవత్సరాలు మీరు సిగరెట్స్ తాగారు అనేది ఇంపార్టెంట్. How long it has been since you stopped smoking, that also matters. Definitely quitting smoking is beneficial any day. It's never late to quit smoking. So if you quit today, maybe down the lane in 10 years, you may have reduced your risk of getting lung cancer or any other cancer by half, or any other lung disease like COPD, chronic obstructive pulmonary disease, as I said, that may come down, and even cardiac diseases. One of the major contributing factors to heart attack is smoking. So, end of the day, quitting smoking is beneficial down the lane. How beneficial is again controversial, but definitely it will benefit you.
So there is hope for the smokers.
Yes, if they quit today.
Quit immediately, some
Yes.
of the damage can be reversed. Do people know when to visit a pulmonologist?
See, pulmonology as a specialty has been very less known. It is not as well known as something like cardiology, neurology, nephrology. So people do understand whenever you have a chest pain, go to a cardiologist. When you have some headache, go to a neurologist. When you have some kidney issue, go to a nephrologist. That way people don't know. మనకు ఊపిరితిత్తు లంగ్స్ ప్రాబ్లం ఉంది అంటే వీ హ్యావ్ టు గో టు పల్మనాలజిస్ట్ అనేది దట్ నాలెడ్జ్ ఇస్ నాట్ వెరీ వైడ్ స్ప్రెడ్. Post COVID, there has been a good exposure to pulmonology. Basically, people have recognized the importance of respiratory system and lungs, and also pulmonologist in cases of respiratory disorders.
How should patients handle all this confusing information that they're getting from Google and social media?
Yes, good question actually. Uh, I would suggest against it. I mean, you should just take it as a place of information and not a place where you diagnose your diseases. Okay, so whenever you have a symptom, there is nothing wrong in looking up your symptom. Like, what can it be? Then let your doctor diagnose and treat you. Never try to diagnose yourself based on Google. Because if I'll give you a small example. I'll take my own system symptom. Let it be a cough. So if you go and search on Google, you may get anywhere right from a throat infection, an allergy, something else, right till lung cancer you may find. So it causes more panic and fear rather than helping you out. So always better, if you want to know for which symptom whom to visit, then it can be helpful. But never try to diagnose yourself based on Google. It will cause more panic and fear than providing you with a solution.
Are there online consultations at Magnaid?
Yes, definitely. People who are unable to visit our hospital, we do online consultations for them. That way, we are able to reach people there who are far away and who want to consult us.
When is it appropriate to seek a second opinion?
See, a person can seek second opinion at any time. But if you ask me personally, I would say if you are visiting a particular doctor, give that doctor some time, because diagnosing a disease may not always be easy. Maybe once first you visit, he or she may give you symptomatic treatment. Then if it doesn't subside, they may ask you for few tests which may lead to further diagnosis. So changing your doctor very frequently won't help you. Give a particular doctor you're visiting some time, give him enough time to test you and diagnose you, follow his treatment religiously. Then if you don't find any relief, then you may think about second opinion.
So now it's time for myth versus fact. I'll tell you a statement and you tell us whether it's a myth or a fact.
Okay.
First one, using inhalers regularly makes patients dependent on them.
That is a myth. This is generally a stigma related to the inhalers that I face on a daily basis. So whenever a patient of asthma or COPD or respiratory disorder comes to me, I ask them to take an inhaler. Regarding nebulizer, it may not be such a stigma, because nebulizer people are willing to take immediately, nebulized medications. But when we ask them to take an inhaler, then they immediately start asking questions that do I need to take an inhaler? Is it necessary? Will I become dependent on it for lifetime? There is no such sort of a thing. You do not become dependent on an inhaler just by taking it. In fact, I would say that inhalers are the best medications for lung disorders, because they act directly on your lungs. So the side effects are also minimal. Rather than taking oral medications, tablets and all, inhalers are the best treatment when judiciously used. Maybe some of it we can contribute to our movies also, where they show that inhaler in a very funny way. So it is not that sort of thing that you are out of breath and you are taking one puff an inhaler and you get ready to rock. It is not like that.
You can't spread respiratory illness if you don't have the symptoms.
That is a myth again. A person without having symptoms can act as a carrier also. Viral infections mostly. So again, you may be exposed to that particular infection. You may be having that organism in your body, but you may not be showing up symptoms. But when others come in exposure in touch with you, they may contract that infection. So that way you can act as a carrier but may not show up symptoms.
People with respiratory issues should avoid exercise.
It is kind of a myth and a fact both, basically. Uh, I mean, people with respiratory, all kind of respiratory illnesses are not alike. So not every person with respiratory illness needs to avoid exercise. Suppose, let's say a person with who is an asthmatic who has intermittent symptoms but not symptomatic regularly, and he has periods of normalcy in between, and if he is not getting breathless or not having symptoms on upon exercise, then that person can work out. That is not an issue for that person. But in diseases like COPD, chronic obstructive pulmonary disease, interstitial lung disease, ILD that we call, so there the person is known to have breathlessness, shortness of breath, ayasam anedi on exertion. So in such cases, such diseases, such underlying causes, that person should avoid exertion.
Shortness of breath is just part of aging.
You can say it is a myth as well as fact, because not exactly shortness of breath common thing that you see in aging, but we can say that our lung capacity or lung reserves go down, lung function declines with age. వయసు అవుతున్నట్టు మనం lung function capacity అనేది తగ్గుతూ పోతుంది. So at that time what happens is, maybe in younger age you may be able to run, walk for a longer distance and not get breathless. But as you get old, same is the matter with other organs of the body. As the heart weakens, kidney weakens, so the same way lungs also goes weak. In that matter of fact, your lung reserves come down and you may feel breathless even after walking a short distance. But that doesn't mean that shortness of breath is a standard symptom that should come along with age. So it may appear as you age because of reduced lung function.
Your lungs are not the same size.
True, it is a fact. The left lung is smaller than the right lung, in the sense the heart is little bit towards left side. So on the left lung we have only 2 lobes. On the right lung we have 3. So left lung is a little smaller than the right lung.
Lung health can affect all organs of the body.
This is a fact. We generally do not recognize the importance of lung function. If you ask me, it does one of the major functions in the body, that is oxygenation. Our body runs on oxygen. So lungs are the only organs which provide oxygen to the body. So whenever we breathe, we inhale the air, vascular level, the oxygen is extracted from the lungs and it goes into the blood. And the same blood is carried to the heart, and the heart pumps the blood to each and every organ of the body, where again in turn oxygen exchange takes place from the blood to the organs. So our body definitely needs oxygenation to survive, and if the lung function is deranged and if oxygenation is not proper, then each and every organ in the body is bound to be affected.
So now we've come to the end of our discussion, and we have some rapid fire questions which you can answer. One thing that everyone should do daily for better breathing.
Pranayama is a good thing to do. Breathing exercises that will help your lungs a lot on the long run.
One personal wellness habit that you never skip.
I would prefer a balanced and good diet. I am a foodie basically, if you ask me. I like having delicious at the same time healthy food. So I do try to like eat healthy as well as tasty food. So that is one thing I would not miss in my daily life, and also adequate sleep. It may not be adequate for me, but at least whatever sleep I am having, that should be a sound sleep.
So do you try to make your healthy food delicious or your delicious food healthy?
Sometimes this way, sometimes that way. It is vice versa. But most often we see a tasty food is not healthy, a healthy food is not tasty.
How do you unwind after a hectic day?
We as doctors generally don't get that much time to unwind, but whenever there is a chance, I do listen to music and just try to sing along with it, reduce the stress levels. That acts as a stress buster for me.
So between social media, YouTube, and a good nap, which one would you prefer?
See, social media and YouTube are always very tempting, but good nap will make you feel better end of the day. So I stay away from social media as much as possible. Here and there, for some fun sake, I do explore social media, but I never miss my sleep on it.
Any fun incident that you can recall that happened in your practice?
Yeah, I do recall one such incident. There was a patient of asthma basically. He was getting treated from somewhere else, and patient was already on an inhaler. So patient just one day came to me, visited my OPD. Patient was like, sir, I have been taking this inhaler since so many days. It is not helping. This, that, everything was going on, and I was also a bit confused that why the treatment is not working for this patient as it should work. Then finally, I just out of a doubt, I asked the patient, show me how you are taking your inhaler. So the next moment, what the patient does is he takes out his inhaler and puffs it here.
Oh, like perfume.
Yes. So he was just spraying the inhaler on his neck. I didn't know how it was supposed to work. Happening in our day-to-day practice, where even these things, like we learn through these things that even the way of taking medications, compliance of the patient, and how religiously the patient is coming to you for follow-up, these are all very important.
Since you've already confessed that you're a foodie, if there was one dish that you had to eat all your life, what would it be?
There is no such dish, I would say, from my side. Like for me, it has been always a habit. Uh, I eat few items for a few days, then my taste preferences change. Then I shift to some other set of dishes. Then I would not like to look towards the older dishes that I had eaten for few days. So this has been a cycle for me for every few days that is happening in my life. So that way I keep exploring different items and I keep eating different types of foods, and that is how I like it to be.
On that funny confession, I think we can wrap up the discussion. Thank you so much for all the useful tips and information you've given us.
Thanks a lot for inviting me. The pleasure was mine coming here and having this discussion. So looking forward to having such discussions again in future.